Hello, this is Dr. Kotkin again. It's a pleasure to welcome you to this new presentation, which is about blood sampling in newborns, the ways and means and the ifs and buts of it. It's a very important topic, common, frequent, practical issue it is encountered in every day in NICU. I am Dr. Kotkin Gengamuthu, MD, DNB, DM Neonatology, first CPCH. I'm a consultant neonatology in Dubai for the last 4 years. My senior colleague, Dr. Rajiv, was previously heading the neonatology department at Amrita Institute of Medical Sciences in Kochi, and he's a senior colleague practicing in Dubai. Let's move forward. Take it here. Next slide. Well, this is what is in the blood. It's a some sort of a 3D view. The RBCs. You can see the biconcave disc. Right. Blood is supposed to carry oxygen for the babies, a vital drug, and sampling of blood is required for many purposes, including estimation of oxygen and the waste gas carbon dioxide. Now here the entire presentation about blood sampling is such an important topic that it cannot be covered in a single presentation. So there will be four parts of it. Part one, this current discussion is about importance of the blood investigations and the need for micro containers and autoanalyzers. We need, because we are dealing with preemies, small babies, premature babies. For now, this lifespan of preterm is brought down to the periviable age is 20 to 24 weeks now, and so we need microcontainers to analyze, and also auto analyzers that are capable of accepting and giving accurate results with the minute volume as possible. Right. So first, after I explain the significance, the next parts will be the ways and means of sampling liver, how to obtain the blood sample. It might sound simple, but it's the most difficult part in NICU. We use capillary blood sampling. Venous blood sampling is a peripheral veins, and arterial blood sampling of peripheral arteries, and an extremely immature where access is an issue. And for conserving the veins and the arteries, central venous access, the easiest access is umbilical vein and umbilical artery that can be used for sampling purposes. Right now, for this moment, it's this part one. I will tell you the importance of blood investigations and the need for the microcontainers and autoanalysis. There will be demonstrative educative videos of them. So now why the blood loss due to sampling volume is an important consideration, because as adults we carry 5 liters of blood. Cardiac output is 5 liters. Neonate has a blood volume of 80 ml per kilo. For a 1 kilo baby, total circulating blood volume itself is 80 ml. And assume that you need to do all the blood tests that are required for an adult ICU in this baby. Understand? We're running it's an ICU. It's a much complicated ICU than adult. Neonate is a miniature adult, but the technology, nanotechnology, is more difficult than ordinary technology. Understand that? Then you'll get this point why I focus on sampling techniques and the right results in the proper evaluation of the baby. So 10% of loss will be 8 ml. That's what adult vacuum it contains 5 ml. There are many with 10 ml as well, and they take 3 or 4 bottles in a row. That's for a 5 liter man or a female. It's okay. Not for a baby who has got total volume is only 80 ml. And 20% of acute loss can cause hypotension and even shock. So in trauma patients also, 10% of loss you go into early shock, 20% definitely shock will ensue. Hypotension, blood pressure will fall. Hence, the minimizing and restoration of blood loss due to the sampling needs is a top priority. And even with the restrictive blood product usage policy, you cannot avoid the need for a top up of acute blood loss. Sampling is such an important issue that babies don't talk, and you have to assume, analyze them, and you should have the appropriate visual cues imprinted in your brain to assess the severity of the illness and to predict their course in the NICU. So sampling is inevitable, can be minimized with expert hands, but it is inevitable. And the more preterm, more immature the baby is, the sampling frequency and the need for sampling is also higher. There you go. Next slide. Just to educate you how small a baby we can be caring for in the NICU, the tiny tots are really tiny. You see the comparison of adult palm, one palm size. It's not palmistry. It's size of the palm. A small baby. This is small. The smallest baby is in the down panel. That's why here you get the smallest baby. One finger, 1.5 finger breadth. This is extremely mature, 350 grams baby. Okay, so a palm size baby or a finger size baby. These are babies who are having 80 to 90% survival in the best units currently. So the total volume in these babies less than sub half a kilo babies will be 30 to 50 ml only, and you need to do blood tests. Acute phase in these babies, acute phase may last up to even a month. At least a week is very acute. 2 to 3 weeks is normal emergency care, needing frequent sampling at least 2 times or 3 times a day for the initial 1 to 2 weeks. So even if you assume 2 ml for each day, half of the blood volume is emptied in 1 week. Understand the significance of microtinus and microanalysis? You should understand this. See these small tiny tots. We, your neonatologists, take care of these small tiniest babies. It needs a great team effort and very vigilant eyes and supervision and support from the microbiology, the biochemical and other departments is needed to ensure the good outcome for these babies. There. Now we should have an understanding about different color codes of the blood sampling tubes that are available, the microtiners that are used
Blood
for neonatal
collection
sampling.
tubes.
Herein, we
Hi there.
see
Welcome
in
to
this
another
video.
Chalk Talk episode. Where we'll be introducing the 6 most commonly used blood collection tubes. These tubes are the serum tube, coagulation tube, erythrocyte sedimentation rate tube, heparin tube, EDTA tube, and sodium fluoride tube. You've probably noticed that we've shown 2 tubes for each type. This is because the tube caps have a distinct color coding system, either in accordance with international or in accordance with European standards. To clearly distinguish the difference between the tube caps of both standards, we'll be using vacutainers colored according to international standards and monovet tubes colored according to European standards. But don't be misled. The color of the tube cap isn't determined by its shape, but by its content. Let's take a closer look. EDTA tubes have a lavender cap in accordance with the international standard and a red cap in accordance with the European standard. They are usually used to measure blood counts. To determine the different numbers of cells in the sample, coagulation in the blood sample should be completely inhibited. Therefore, the collection tube contains EDTA. The underlying principle is actually quite simple. Calcium, also termed factor 4, is important in blood coagulation. When calcium is removed, blood doesn't clot. So let's look into this in more detail. Calcium mediates the binding of coagulation factors to negatively charged surfaces such as the cell surface, thereby facilitating blood clotting. You can find out more in Part 3 of our series of Chalk Talk episodes on secondary hemostasis. Let's take a look at what EDTA does. To ensure that there's no calcium in the blood sample, a molecule that has a high binding affinity to calcium is required, EDTA. The EDTA molecule and calcium form a complex, which results in calcium unable to initiate coagulation. EDTA can bind to a maximum of 6 atoms. However, it also forms stable complexes with fewer ions. One molecule of EDTA can therefore bind to several calcium ions in blood, resulting in an undefined ratio of both substances. As a result, the inhibition of coagulation with EDTA is considered irreversible, as it remains unknown how much calcium would be needed to restore original conditions in the collection tube. Blood cells usually preserve their morphology in the presence of EDTA. Therefore, EDTA blood is mainly used to analyze blood cells. The most commonly performed hematology tests on EDTA blood include the complete blood count, differential blood count, as well as blood group typing. A larger collection tube is usually used for immunohematology tests. EDTA blood is also suitable for determining hemoglobin A1C, several genetic tests, for example, single-point mutations such as factor V Leiden, and pathogen detection, for example, HIV via polymerase chain reaction, in short, PCR. However, there are tests for which EDTA blood is not suitable because EDTA can bind to any divalent ion. Therefore, calcium or magnesium levels can't be determined in EDTA blood. In addition, the activity of enzymes whose spatial structure is stabilized by such ions also can't be analyzed. To determine the level of these ions and enzymes, blood should be collected in a serum tube. A serum collection tube is used if serum is desired for analysis, which is obtained after the blood is allowed to clot. Clinical chemistry analysis of electrolytes, such as calcium, and various liver function tests are usually performed in serum. Serum tubes are also used in serology, especially for the diagnosis and monitoring of rheumatic, immunologic, and infectious diseases. To promote blood clotting, silica particles are present in the tubes, acting as a clot activator. You may have heard of glass initiating blood clotting. This is due to silica, a major constituent of glass. Silica has numerous negative charges on its surface, which help activate factor XII, also known as Hageman factor. Factor XII initiates the intrinsic pathway of coagulation. Nowadays, blood collection tubes are made of plastic, and to compensate for this, they are either coated with silica or contain silica-coated beads. Serum tubes are characterized by a red cap according to the international standard and a white cap according to the European standard. These tubes don't contain a serum gel separator. However, there are also tubes that contain a serum gel separator. These have a yellow cap according to the international standard and a brown cap according to the European standard. The separation gel acts as a diffusion barrier because it has a specific density between that of serum and coagulated blood. During centrifugation, the gel forms a stable barrier between these two layers. This barrier significantly reduces serum contamination by cell components and increases serum yield. However, if a variety of laboratory parameters are to be measured, several tubes should be collected. One advantage of serum samples is that they can be frozen and stored for future use. To analyze coagulation parameters in blood, a sample is required in which coagulation is not irreversibly inhibited, as accomplished in the EDTA tube, but the blood sample must be reversibly stopped from further clotting before measurement. This is achieved using coagulation tubes, which contain sodium citrate. Therefore, they're also often referred to as citrate tubes. Coagulation tubes have a light blue cap in accordance with the international standard and a green cap in accordance with the European standard. Temporary anticoagulation in the coagulation tube functions similar to that in the EDTA tube. The only difference is that calcium is removed using citrate, which binds less strongly than EDTA. The calcium citrate salt formed in blood in the collection tube, following the addition of citrate, has a clearly defined stoichiometry. 2 citrate ions are able to remove 3 calcium ions. This enables the required amount of calcium to be added to the blood sample to restore original conditions in the collection tube. Subsequently, coagulation parameters such as prothrombin time, or PT, and activated partial thromboplastin time, in short APTT, can be analyzed. But take care. To avoid false measurements, correct ratios are required. The collection tube must be completely filled with blood and not contain any additional air from the collection system. The heparin tube has a green cap in accordance with the international standard and an orange cap in accordance with the European standard. It contains heparin. Heparin is a polysaccharide that acts as an anticoagulant and forms a complex with antithrombin 3. Antithrombin 3 inhibits blood clotting by binding to the activated forms of factors 10 and 2. However, as a complex, antithrombin 3 and heparin inactivate factors 10 and 2 more rapidly. Heparin tubes are used, for example, to measure the immune function of white blood cells or to perform chromosome analysis. So, what is the difference between a heparin tube and an EDTA tube if both tubes inhibit the coagulation process? Both tubes initially appear quite similar. In fact, many clinical chemistry tests that can be analyzed in EDTA tubes can also be analyzed in heparin tubes. However, EDTA tubes have an advantage. EDTA also inhibits calcium-dependent enzymes, resulting in a more stable sample. Therefore, sensitive parameters can be detected over a longer period of time. Consequently, EDTA tubes have become a standard in the measurement of numerous laboratory parameters. Yet, EDTA tubes also have a disadvantage. EDTA affects cell function and is therefore unsuitable for functional analysis. For this reason, heparin tubes are the preferred choice in analyzing cell function. The sodium fluoride tube has a gray cap in accordance with the international standard and a yellow cap in accordance with the European standard. It's used to determine glucose or lactate levels in blood. To accurately measure blood glucose levels, glycolysis in red blood cells must be inhibited. Otherwise, measured glucose levels will be too low and lactate levels too high. To prevent this, fluoride ions are used to inhibit important enzymes involved in energy metabolism. In addition to sodium fluoride, other agents are sometimes added to stop metabolic processes. These include calcium binders such as citrate, oxalate, or EDTA, which are often added to the sodium fluoride tubes. Analysis of the erythrocyte sedimentation rate, in short ESR, can provide initial evidence of the presence of an inflammatory process. The collected blood is stored at room temperature for a certain period of time. During this time, a sediment of blood cells is formed. This occurs rapidly if acute phase proteins are increased in blood in response to inflammation. One of the reasons is that acute phase proteins decrease the surface charge of red blood cells. As a result, the red blood cells do not repel each other and therefore form large aggregates, sinking to the bottom of the tube. Because the ESR not only depends on serum protein composition but also other parameters, results are only of significance if rates greatly differ from the normal reference values. ESR measurement can only be performed in anticoagulated blood. Therefore, the anticoagulant citrate is also used in ESR tubes. The distance in millimeters at which red blood cells fall after an hour is read using a special scale. Although the ESR tube is easily recognizable by its narrower diameter, it can also be identified by the distinct color of its cap. ESR tubes have a black cap in accordance with the international standard and a purple cap in accordance with the European standard.
Self-extraction tubes, vacuum-assisted suction type tubes come into aid the
The
neonatal
Inovac
sampling
from
process,
Innovative Medical
especially extraction
Technologies has
process of blood
revolutionized capillary
from the
sampling
neonate
with
capillary
vacuum-assisted
will
collection.
stick
The quick draw
onto the
adapter
sampling
fits the
tubes now.
BD microtainer
Can you
capillary.
see? Inovac has had this greatest innovation of percutaneous assisted blood collections.
Collection container so that it can be used with the Inovac vacuum unit. The adapter contains a capillary straw that is internally coated with anticoagulant to allow the blood sample to come into immediate contact with the anticoagulant, eliminating one of the major causes of clotting. This is especially helpful with slow bleeders. The quick draw adapter also contains a primary vent filter that prevents blood and airborne particles from escaping the collection vial. A secondary hydrophobic disc filter is in place in the Inovac unit to prevent any blood from entering the unit should the primary filter fail. This filter is located beneath the round screw-off cover. You should check the cleanliness of the disc filter before use. The filter is easily seen through the hole in the cover. If it is contaminated with blood, then you'll need to replace it before proceeding. Unscrew the round cover by turning counterclockwise and remove the filter by turning it counterclockwise. You can use forceps or something similar to grasp the filter to make it easier to remove. Replace it with a new filter and tighten finger tight. Replace the round cover on the Inovac. The Inovac operates on a standard 9-volt battery and is easily installed. The quick draw adapters attach to the BD microtainer vials for plasma, whole blood, or serum samples. Be sure the adapter is pressed completely onto the container. If it is not, you may experience less than optimum vacuum during collection. Pre-assemble all of the collection vials you will need for this draw before performing the skin puncture. Pressing and releasing the blue button on the unit activates the vacuum. Pressing and releasing the button again stops the vacuum. You can rotate the assembly on the Inovac to allow the Inovac to be in a comfortable position for you. Press and release the blue button to activate the vacuum and apply the tip of the quick draw adapter to the blood droplet that is present at the puncture site. Avoid scooping the sample from the puncture site. The vacuum action draws the sample into the collection vial. This eliminates the need to scoop, which causes hemolysis, and less squeezing is needed because the vacuum will collect even the smallest drops. You don't need a large hanging drop. During collection, air being pulled through the vial causes the sample to mix automatically with the anticoagulant in the vial. This eliminates the need to stop and tap and mix the sample during collection. This automatic mixing leads to fewer clots, less hemolysis, and fewer re-sticks for your patients. You can check the volume of sample collected by pressing and releasing the blue button to stop the vacuum. This allows the sample to settle so you can see the volume of sample collected. Simply press and release the button again to collect more sample. To collect another sample type, simply remove the quick draw assembly you've just filled from the Inovac and attach the next quick draw assembly. After collection, remove the quick draw adapter from the microtainer and discard into a biohazard waste container. There will always be a small amount of sample in the capillary straw. Disregard this, as it is a very small amount that is difficult to remove. Cap the collection vial with its original cap, mix well, and process accordingly to your facility's standard procedure. For infection control, the Inovac can be cleaned and disinfected by wiping the unit down using your standard disinfecting procedure. A disinfecting wipe works very well.
Once the samples are collected and sent to the lab, nowadays the lab analyzers are so miniaturized and automated, fully automated, that can run rapid turnover, 600 tests per hour, and the minute sample volumes required will be astonishing. Don't get shocked. It's only zero point 0.1 ml is needed. In fact, if you see clearly, see here, you can see that can be down to 80 microliters with perfect results. 80, 1 ml is 1000 microliter. So 80 microliter will be 0.08 ml. 0.08 ml of the reaction volume, you will get excellent, perfect results. And it is economical also because there is no human interface is minimized, and it runs the spinning, separation of sample, everything is done by the machine only. So with this accurate sampling, the dependable results to run the ICU for the sickest babies. With this, I thank you for your patient listening. Please visit my channel, NeoG Heal Thy Babies YouTube channel. So, thank you once again. This is the part one of blood sampling in newborn, the ifs and buts and the need of it. Part one of this series. Thank you.